And new tonight here on The Current, there are new efforts to make mental health care more accessible in Muscatine. This fall, the Community Foundation of Greater Muscatine awarded $75,000 to community health care. That money will now hire a full-time psychiatric mental health nurse practitioner. But what does that mean for people seeking mental health care in and around Muscatine? For that, we turn to Tina Plett, Director of Clinic Operations for CHC. Tina, thank you so much for being here with us today. Can we start with this nurse practitioner role? How different is this role from a traditional mental health therapist?
Sure. In primary medical care, we're looking to identify, what needs the patients have. And so when they see one of the providers at community healthcare, we're identifying right away at every visit what tools are needed. And so when you have a psychiatric nurse practitioner, that's someone who's going to do a full psychiatric evaluation, identifying if medication management is the right next step or if therapy and medication management is the right step for them. And so having that psychiatric nurse practitioner readily available gives that next level of care in addition to partnering with therapists.
In the world that we live in today, a lot of therapy can be done over telehealth. And I know there's lots of people at CHC in the Quad Cities that have this nurse practitioner role. So what is the significance of having someone full-time in person in Muscatine offering this?
Absolutely. Some people prefer to have the telehealth course and have that, ease of being able to access care from home. But really, a lot of people want to be able to sit down and have that in-person conversation with the patient and with their provider. And so being able to have the in-person option right there in their community helps to ease that access. We've seen throughout health needs assessments done in the Muscatine community that it's such a need to have that access there. And transportation can be a barrier trying to go outside of the Muscatine community. So having that in-person opportunity, that relationship right there really can make all the difference for a person.
Now, I know I'm getting ahead of myself a little bit. The Muscatine facility is about to open next year. We'll get to that in just a moment. But once it is open, how would someone start services with a nurse practitioner such as this?
For sure, they can either call our main line to reach out to our team, who can then get them scheduled for an initial assessment, conversation, seeing what that first step is. Otherwise, they're happy or welcome to stop into the clinic and we can get them scheduled then. Our team does a really good job of working the schedule. And so we always have like an overflow of if somebody doesn't show up, we'll work somebody else into the schedule that day. And so really, stopping in or giving us a phone call will help to get them on the schedule.
Well, like we mentioned, this all ties into Community Healthcare's brand new building that's going to be opening in Muscatine early next year. You've been working toward this location for 20 years now. Do you have a clearer picture of when it will officially open for service?
Yeah, we are looking at January as a start date for us. We've been in the community since 2019 through a partnership with the University of Iowa for dental services, and we had a small medical clinic. So being able to have this 13,000 square foot location where all of the service will be integrated into one site is going to be outstanding for the community. Having that one place to be able to go to have all of your healthcare needs addressed will be outstanding. We're very excited.
Yeah, like you mentioned, this location is going to offer behavioral, medical, and dental services. And it's open to anyone, but you're focusing on people who are at about 200% below the federal poverty level, which CHC has estimated is about 10,000 people in Muscatine. So how great is the need for community health care in Muscatine?
There is a significant need, as you stated, with the number of clients that fall into, that category. We provide services to everyone, but we have, the ability to provide additional support for those that maybe don't have the same amount of resources or, even if they are privately insured, there's high deductibles and out-of-pocket costs. And CHC is there to be able to assist with making sure that no matter what, everyone has access to that health care.
Yeah, and a January opening is going to come up real soon. We can't wait. Tina, thank you so much for joining us. We really appreciate your time. If you guys at home want to share this story, you can find our online version up at WQAD.com. Just click on the As Seen on TV tab.